Psychedelic medical research in Australia is well behind the research being done in the UK and the United States. The not-for-profit Psychedelic Research and Science and Medicine Incorporated, or PRISM, was set up over 7 years ago to initiate and progress psychedelic medical research in Australia. PRISM is currently collaborating with the US-based MAPS, Multidisciplinary Association for Psychedelic Studies. Martin Williams is the president of PRISM and a postdoctoral researcher in pharmaceutical sciences with Monash University. So what is the state of psychedelic research in Australia so far?
We feel it's basically in a long gestational period. We're very hopeful that, we feel that things are coming together very quickly at the moment. At this stage, we're at the point of having made 2 ethics committee proposals. So we've made 2 proposals to ethics committees within Australia, and we've been knocked back explicitly on one occasion. And the second occasion, in fact, our application was stopped before even application to the Ethics Committee by the Deputy Vice-Chancellor of Research of that university, basically saying that the university didn't want any possibility of adverse publicity, which was unfortunate, understandable perhaps, but it really underlines the conservatism in the academic sector in Australia at the moment. The trial that we are aiming to get off the ground is a contribution to the global research using MDMA-assisted psychotherapy for post-traumatic stress disorder, for PTSD.
So why do you think there is such resistance in Australia?
I think there are several reasons. One is that perhaps the Australian community is maybe a little slower to adopt some of the more progressive aspects of these research programs. Certainly the university sector is also rather resistant to some of these ideas. This may be due to the reliance in Australia on a public funding model for research. So universities, unfortunately, are being slowly starved of funding on a number of levels. And so, quite understandably, they have an aversion to risk which might compromise their financial viability. And then on the more personal level, researchers are also very much dependent on the public funding model through, for example, the National Health and Medical Research Council. And so it's an extremely competitive field trying to win public funding for research programs. And at this stage, we feel we're probably so early in the overall journey towards getting these research programs underway in Australia that it's going to be difficult for us to compete.
So why is it so important to progress research in psychedelic medicine here in Australia?
Well, the results from the overseas trials that have been completed have been so compelling that we feel that psychedelic psychotherapies, really can take a place among the various responses to some of these illnesses for which they're being used. So we feel that there's a potential demand for these practices. We feel that they're overall very safe and manageable therapeutic processes. And really there are people who desperately can really benefit from these approaches.
Martin Williams. Steve McDonald is a co-founder of PRISM. He became interested in psychedelic therapy due to his own mental health issues.
I've had a series of traumatic incidents throughout my life. I had an accidental poisoning incident when I was 15 months old, which put me into hospital. And then I joined the Army after I left school and had a 15-year Army career. And as part of that, I served in Africa during the war in Somalia as an infantry officer. And after I left the military, I was a rescue helicopter pilot for 5 years. So I was working in emergency services and responding to all sorts of accidents and things. And so I witnessed a lot of trauma in that job as well. And it was really something that crept up on me over time. You know, I think for a lot of people who have traumatic occurrences, it can kind of lie dormant for a while and then sort of bites you, you know, sometimes 10 or 20 years later or even more. And for me, it was 10 years after my war service that it really struck me down. You know, I had a breakdown, yeah.
So tell me about some of the ways that it affected you and what the feelings were that came up.
Sure. I think it's pretty well known that PTSD is often accompanied by depression, and that was probably the first thing that I noticed was just recurring bouts of depression and difficulty controlling my emotions, particularly being quick to anger and having just a bit of emotional upheaval from time to time. And then when I actually came to the point of breakdown, I'd been through a very stressful time over about 12 months or so before the breakdown. Like, my marriage broke up and I sort of changed jobs and moved interstate, so my network of friends shifted and those sorts of things. So it was a compounding effect. And also it was in 2003 when we sent some troops off to I think it was the second Iraq War at that point, and witnessing young soldiers going off to war on TV I found quite distressful, just, having some understanding of what they were going to go through. And so in terms of the physical effect on me, I had difficulty sleeping. I'd have nightmares and wake up sweating sometimes, losing interest in things that I would normally do, like recreational and exercise, type activities, and anxiety attacks from time to time, and ultimately great difficulty focusing, to the point where I just couldn't work. I would sit down at my desk and I just couldn't get my brain clear enough to even do an ounce of work. And it all sort of came to a head to the point where I started having thoughts about suicide. And I realised, that wasn't right. So I reached out to, at the time, what was the Vietnam Veterans Counselling Service by phone, and they actually sent me straight to hospital.
And what treatment did you get then?
So I went into the Veterans Psychiatry Ward at Heidelberg Repat Hospital in Victoria, and I was medicated with antidepressants and really just had a period of rest and recovery. And then I went on an intensive course of counselling, which started out with one-on-one counselling twice a week. And they put me on a group therapy program, which ran over 3 months. And that was 2 4-hour sessions each week, which I did together with 5 other veterans.
And how did that help?
I was off work for 7 months from the point that I first went into hospital. So it took me that long to get to the point where I could perform, work again. But when I did go back to work, I only worked part-time, and I never really returned to full-time capacity. But I'd accrued quite a large debt on my credit card during that 7 months that I couldn't work. I had great difficulty getting any financial support from Veterans Affairs. That was a real struggle, and carried that debt for probably 6 or 7 years after that. So that was a long-term impact that was quite distressing also.
Steve McDonald then came across psychedelic-assisted therapy.
My first encounter with any kind of psychedelic therapy was actually with ayahuasca, and that was about 3.5 years after I had my breakdown that I came across that. And I very quickly found that my depression was resolved, by drinking ayahuasca almost straight away. And so that was something that I sought to do, as often as I could to treat my depression. And at that time, I managed to drink around once every 3 months or so. So that was the first insight that I had, that these illicit drugs, psychedelics, could actually be medicine. So I had no idea prior to that. And as a result of that, I started to take an interest in conferences like the Entheogenesis Australis Symposium, which would happen every year at that time. And I'd also seen media reports about research in the USA using MDMA-based therapy to treat PTSD. And that was quite interesting to me because the conventional treatment just hadn't really dealt with it at all. I was still suffering anxiety attacks and a whole bunch of other symptoms at that point. And then I heard that Rick Doblin, the founder of MAPS, the Multidisciplinary Association for Psychedelic Studies, was going to speak at the 2010 EGA conference in Melbourne. So I flew down to Melbourne to attend the conference, and Rick offered some money during his talk to get some research happening in Australia. So I actually stepped up as a volunteer to help create PRISM at that time. And I still hadn't had any access to or tried any kind of MDMA therapy at that point. But I got involved in the formation of PRISM and got on the management committee, and was getting access to all of the MAPS documentation from their research, their treatment protocols and those sorts of things. So I was able to become very well informed about MDMA, how it was affecting people during treatment, and what kind of protocols they were using for the treatment. And then, of course, started to think about, well, how could I get access to this? And, it really wasn't practical to be able to access the trials that were happening in the US for a number of reasons. I think they had more than enough people volunteering for it there and only a few places. So I was quite patient and waited for an opportunity to arise. And after a while, I did get an opportunity to access some quite pure MDMA, and then followed the MAPS treatment protocol and actually self-administered, just in the company of a friend. So there was no therapist at all. And I found the effect was remarkable. I really just went straight into a blissful state as soon as the MDMA kicked in. Interestingly, I didn't have any recall of trauma at all during that experience. But that blissful state lasted for sort of 4 or 5 hours, and then I went to bed that night. And when I woke up the next morning, I felt calmer than I can ever remember. And there was an obvious absence of this background anxiety that I'd been carrying for so long. It had just become like the normal state for me. It just seemed normal. And that was missing. It was gone. And that was just remarkable. And that effect persisted to this day. It wasn't a cure, like it wasn't a magic pill that fixed me straight away. I still had difficulty with PTSD after that experience, but the degree of difficulty was far reduced. And there's been lasting effect from that simple self-administered session. Yeah, so I can see if you had access to a full MDMA-assisted therapy program, I could see it could be remarkably powerful, because just that one experience without therapy was quite effective for me.
So in your current role now with PRISM, what's your aim? What would you like to see?
What I'd like to see is anyone who suffers from post-traumatic stress being able to access this therapy. The fact that it's just been classified as breakthrough therapy by the Federal Drug Administration in the USA, I think is wonderful. And it just speaks to the power of MDMA as a medicine. So it really, it should be available as soon as possible, I think.
Steve McDonald is a co-founder of the Australian-based Psychedelic Research and Science and Medicine Incorporated, or PRISM.